I'm here with Dr. John Torous to chat about innovation here at the APA annual meeting. How are you doing so far?
Wonderful, thank you for inviting me.
So innovation and technology are really central to this meeting this year, at least it seems like to me. So why is it so important?
You know, I think what we're seeing is there was this idea of a digital divide. In the past, we thought that perhaps not everyone had access to smartphones, to technology, that only certain people would own an iPhone or Android phone. In the last couple of years, we've realized everyone in the world is increasingly owning a smartphone, has access to it, whether you have a mental illness or not. And we found that folks that we treat, our patients, are using apps, they're using these things already. They're finding all this technology and they're using it, and that means we as a field need to catch up and learn about what are the best practices, what are the safe ways to use technologies like smartphone apps for clinical care.
Right, and there's a mental health innovation zone, and you did a talk there.
Yes.
Can you talk a little bit about what people learned from you?
So we had a panel called Wearables Beyond the Wrist, because we wanted to show people this technology is evolving really quickly, and a wearable no longer means, say, a Fitbit or something on your wrist. There's a whole new world of sensors that we're using for mental health. So we had 3 panelists. One was a representative from Otsuka Pharmaceuticals, and they've actually developed a new pill called a digital medicine, where when you swallow the pill, it actually emits a signal that says you swallowed the pill. So we can actually monitor, they have FDA approval for ingestion data, so it's a whole new way to understand how people are taking their medicine, how they're experiencing it. We also had a panelist from Spire Health, which is a new wearable that you just stick on your clothing. It's a little sticker.
Oh.
And so instead of having to wear something on your wrist or a sensor, you put the sticker on and it can get information on your breathing patterns for up to 2 years. And they said it survives a lot of laundry loads, which is really impressive. And then we had a third speaker from Tufts talk about Recycle Health, where he said, you know, a lot of people will buy a fitness tracker and after 2 months stop using it. You can send your fitness tracker to Recycle Health and they'll actually give it to someone in need in a community who wants it.
So how does this change the way that psychiatrists operate?
So I think the beauty of technology is we can extend and augment what we do in a clinical visit. We can take that patient-therapeutic relationship that's so valuable and we can bring it to people who don't have access to care, and we can help people basically share their lived experience. So when you come in for a visit, we can talk to you, we can learn about what's happening, but what if we can capture how does the environment impact how you're feeling? How do different stressors impact how you're feeling? And then we can also say, how can we use the environment to heal people? How can we tell people these are interesting areas that you feel better in, these are ways that you're going to sleep better at night? We can really push lifestyle interventions because we can monitor and understand the lived experience outside of the clinical visit. So in some ways it extends our reach and lets us kind of offer lifestyle interventions in a whole new way that we couldn't before.
Very cool.
Yeah.
Are there any exciting sessions?
So I think there's a lot of exciting sessions here that I'm looking forward to. There was one on computational psychiatry that the director of the NIMH, National Institute of Mental Health, was talking about all these different ways to use data science and big data towards understanding ways to even redefine mental illnesses. So.
Wow. Well, enjoy the rest of your time here
Thank
in
you.
New York City, and thank you for sitting down with me.
It was a pleasure. Thank you.